This conference will now be recorded.
Okay, here we go. So, hi everyone. I see some new faces here, which is great. My name is Frank Rivera. Um, when did we start this? In December, right? We started this in December. Came out. A lot of people were saying that they felt alone, and I wanted to make sure people don't feel alone. And so I made a national online group because I know it's hard for some areas to get to a support group, and a lot of people don't have support groups in their areas. So this is kind of that bridging that gap. So we have people from all over, and I'm from New York, Long Island, New York. I started Sarcoidosis of Long Island 9 years ago, and then just this month, we started Stronger Than Sarcoidosis. The reason why we started that one is it is patients helping patients. That's what it's about. The board is all patients, and because we know what you guys go through, and a lot of us have been through the same things, and also, but there will be different things that we've gone through that you haven't. But if we don't know the answer, we'll find out the answer for you guys. So we wanted to have that something that organization that is very patient focused. So that's just started, and that's how Deanna, I know because she sent the email. So there's a website up already. You'll see Kathleen is a secretary of Strong, and she's also the vice president of Sarcoidosis of Long Island. So I'll let Kathleen go on, and you could tell a little bit about yourself.
Didn't you want to tell everybody where you have your sarcoidosis and how long, Frank?
Well, all right. I have my sarcoidosis everywhere. The last two places that I didn't have it was my kidneys and my liver were the only two places I didn't have it. But unfortunately, it looks like I have it in my kidneys now too. I don't have a confirmation yet because I'm going through kidney stones right now. So until that's done, I can't get a confirmation. But there is a lot of white spots on my kidneys, so that just tells me I know what it is. But I don't even know if we're gonna do a biopsy on the kidney. I don't even want to do it at this point. So, but I guess then I got it. I was misdiagnosed in 2004. They told me I had lung cancer. What happens a lot, but for me, they went a little bit overboard, and I went through 4 years of chemo and radiation for nothing. So yeah, so by the time I got diagnosed in 2011, I had it in almost 75% of my body already because of the chemo and radiation wore down my body, which made the sarcoidosis grow faster and go in other spots and places. So that's my story, a little bit of my story. So go ahead, Kathleen.
Thanks, Frank. Sorry for putting you on the spot there.
But, okay.
Okay. So hi, everybody. My name is Kathleen. I'm from Long Island, New York. I met Frank 6 years ago. I was diagnosed with sarcoidosis 10 years ago, and that was initially, 11 years ago from a skin lesion that did not come up as the last punch biopsy. I had 2 on that lesion, said possibility of sarcoidosis. It was the first time I had heard that word. So then that led to a CAT scan with contrast, PET scan. We've all been there. I've had a piece of my lung taken out in 2010, and the doctor said I definitely had cancer. He was staking his reputation on it. Well, his reputation is pretty much squashed in my world because it's sarcoidosis. At this point, I have sarcoidosis throughout my whole body except for my kidneys and my eyes. From that, I've also gotten small fiber neuropathy, connective tissue disease, autonomic neuropathy. I have a 5-centimeter hiatal hernia that no one will touch because my stomach's like up in my throat. So you have to bring it down and tie it down in your stomach. Don't want to do that. So been going through a tough time lately. I've always tried to do things holistically and not necessarily, hi Rick, not necessarily with medication, only prednisone for bad flares. Of course, hemp to lower inflammation, foods to lower inflammation, other ways of going about it. However, as Frank can tell you, unfortunately, lately, I've been in a very bad flare for more than 4 weeks. And last night was my first dose of methotrexate. They put me on that very quickly once I said, okay. So that's about it. Oh, the reason why I met Frank was I felt alone and I was Google searching and all of a sudden Sarcoidosis Long Island came up and I was like, what? And ever since then, I used to work full time. I'm no longer working. I just filed for disability, sadly. I've had to give up most of my life, as most of all of us do, for this disease. And you know, some sad things recently. I'll never be a dance teacher again, which is another negative for me. I've been dancing for 54 years of my life, so my whole life, you know, since I'm a year and a half old, and I could no longer stand on my legs long enough to do that. So, you know, been going through a little bit of a tough time, as James knows, because I was able to speak to him and Frank. So know that I'm always here and Frank's always here, as well as Regina and many others. So that's all I want to say. Frank, back to you.
Okay. Yeah, Kathleen is one of the moderators, as is Regina and Chasta, are all moderators, and myself, of course. But I'm going to pass it over to Regina. Go ahead. All yours.
Hi, everybody. I am Regina, and I just want to draw attention to Petra. She's from Indiana, not far from where I live at.
Hello.
But I was diagnosed in 1994. Went in for pneumonia. Was hospitalized that same night. Found a big mass of granulomas on my chest. They thought I had non-Hodgkin's lymphoma. It turned out to actually be sarcoidosis. At first, they diagnosed me as having non-Hodgkin's. By the end of the week, it was actually sarcoidosis. I do have it in my lungs. I'm pretty sure I have neural sarc as well. The last 2 years, I also have skin sarc. The last 2 years, I have been in the most major flare I can ever be in. Last year, I got on steroids because I was in a flare. That steroid sent me into almost a diabetic coma. I was hospitalized for 2 weeks. My A1C was 511. My blood sugar was 511. A1C was 12.8. I finally brought that down this year. Now it's a 5.5. I'm happy about that, but they still have to keep an eye on that because you never know what's going to happen. So then don't consider me a diabetic. But with that being said, diabetes run in my family. So as a result of the 2-year flare up, I am now on Remicade. I started Remicade back in August. I'm doing pretty well with it. My body is doing all right. I had lots of gastrointestinal issues for the last 2 years. Lo and behold, as soon as I got the Remicade, a lot of those issues went away. So I am pretty sure I have sarcoid in my gastrointestinal system as well too. So I have my next doctor's appointment is September 3rd, and I go receive all my care at Cleveland Clinic. With that being said, I'm still working full time and I'm going to school part time still. So that in a nutshell, I'm a busy person.
Yep. All right. Chasta, did you want to introduce yourself?
All right. Hey, everybody. A lot of you probably already know me. I have been missing for a while. There's been a lot going on in my world. And most recently, I became a patient of the cardiac sarcoid clan. So, where I'm actually gonna get off, I wanted to check in with Frank for a second. I have to go back and do some laundry because I got to pack, because my sarcoidosis specialist and the hospital where I'm going to have a minor heart procedure done is about 3.5, 4 hours away. So I have to get packed and ready to leave. I have a doctor's appointment in the morning here in Greenville, and then I have to travel there tomorrow, and I have to be at my hotel by a certain time because I have a few things that I have to do before Thursday morning. But nevertheless, I'm still smiling. I have sarcoidosis everywhere now, except for my neural system. So that's the only place that I don't have that sarc is not affecting me. Everything else, skin, kidneys, lungs, um, gastro, I've had in my 34 years of living and in my 15 years of fighting, I've probably had like 6 colonoscopies and endoscopies and all that kind of stuff like that. So I'm a baby when it comes to sarcoidosis, but I'm very mature with this disease. I know it. I can tell you sarcoidosis with my eyes closed and my hands tied behind my back. So it's been a journey. There's been good days, there have been bad days. I am no longer working as of coronavirus 2020. Because what I'm not going to do is I'm not going to put my own self at risk. I could really care less what a White House says, what a CDC says, what a health organization says, anything. Nobody's going to take care of me like I can take care of me. So my thing is, I know it's out there. I know it's real. I've had family members pass away from it. I've had friends pass away from it. I've had family members and friends both who've recovered. But at the end of the day, all of those people could have prevented their COVID diagnosis. So as of coronavirus 2020, my last day working was March the 13th. I have not had a paycheck since. But at the end of the day, I still have lights, I still have water, I still have food, and I still have something to get me around from place to place. So I'm not complaining. A job can be had. I can work from home if I choose to. If not, I can just draw disability. But knowing me, my family and my friends call me a little bitty Jamaican because I like to work 2 or 3 jobs at one time. If I feel good, I want to do good. So we're just, in this storm for a little while. At the end of the storm, the rainbow has to shine. So I'm just going through this tsunami, but I'm looking forward to the rainbow. So I am going to actually go ahead and get off. I wanted to say hey to everybody really, really quick. I miss you guys so much. But I do have to take care of me, not only physically, but mentally, emotionally, spiritually. And I encourage everybody to do the same thing. Sometimes you just got to step away. Sometimes you have to get yourself together. Sometimes you have to, sometimes you just have to find that one thing that just makes you happy. And so I've found, even in the midst of the turmoil, and everything that I feel like is negative right now, there's still always a positive side to everything. You have to look for that positive side. And the fact that I have life, the fact that I'm living, the fact that I can still breathe, it might be with the assistance of oxygen, but I still have breath in my body. So I'm thankful and grateful for that. 15 years sarcoidosis. It took 15 years for it to affect my heart. To me, that's amazing. To me, I'm grateful for that. I have a big heart as it is. I'm always giving. I'm always available. Y'all just give me a couple weeks to kind of get adjusted to this new treatment regimen or whatever is about to happen. But I'm just a phone call away. I'm a click away. I tell that to any and everybody. If you ever need anything, if I don't have it, I'll try my best to get you a resource that does have it. So I'm always accessible. I'm always available. You don't have to go through this alone. You don't have to be by yourself in this, emotionally or mentally. It's enough of us out here to where you don't have to experience anything by yourself. So I'm fortunate enough to have a team of people around me who are uplifting me and holding me accountable so that I don't eat my words. Because it's easy for me to tell you all that I got your back, but I don't even have my own back at sometimes. So I have those people around me who are uplifting me and making me use my words to give me and the strength that I need to move forward. So Frank, thank you for this moment. Thank you for this opportunity. Just wanted to check in for a second. But yes, I'm accessible. Anybody call me anytime. I probably won't be on the next call or anything like that. Still be recovering. But Frank, I will get with you. But I'll see you Tuesday. So I will see you Tuesday.
Yes.
And everybody join the call on Tuesday, okay? All
All
right.
right, good luck.
Y'all have a good one.
Yeah,
Be
we'll
safe.
be praying for you.
Good luck.
Thank you.
Okay, so now I'm going to start with Jackie, since you were one of the first ones in the room. I'm going to have you start. Just tell us about yourself, when you had sarcoidosis, a little bit about that.
Okay, well, I'm from Wisconsin, and I am a baby at this. I just got diagnosed this year. Actually, I got misdiagnosed, and my doctor called me at work and told me I needed to hurry up and get to an oncologist because I had non-Hodgkin's lymphoma, and that just threw me for a loop. So that was in January, and it was just by happenstance. I had a CT scan for kidney stones, and that CT scan showed the sarcoidosis all over my spleen was very involved, along with quite a few patches in my chest, my heart, and then I'm wondering, because I've had some issues with my gastrointestinal, like with bloating and just gas and just not able to. I wish I was not able to eat anything, but anyway, they did a biopsy on my back, and they weren't able to take the whole node, and the oncologist said that she wasn't 110%, that it was not the cancer. And I says, well, I want to know because, I'm not going to walk around like, well, it could be this or it could be that. So then a team of doctors got together, specialists got together, and she thought the lymph nodes in the right groin would be good, but they weren't a hot spot or the hottest spot. So the team of doctors agreed that it would be the best to take 2 nodes that were really hot off of my heart. So I went in and had a second biopsy. They signed me up or assigned me to a surgeon on, I think it was Wednesday the 12th. And I think he had some idea that things were going to be shut down because I says, well, could we do this over spring break? I was a teacher, and he says, how about we do it tomorrow if you don't mind waiting for the robot to be available, because I'm not assigned to the robot and we have to do it robotically. So I said, I don't care. I says, hey, if you can do it tomorrow, that's great. And otherwise, I would be still waiting for a diagnosis because everything closed down. And of course, they didn't do any of the elective surgeries. So God was on my side then. He started me on my pulmonologist. Oh, and I have it in my lungs. My pulmonologist started me on 40 milligrams of prednisone, and I am down to 20 milligrams right now. I'm dealing with skin sarcoidosis, and so if anybody can give me any ideas, I just made an appointment with a dermatologist, and I will be seeing her in September. But I have it on my legs and, just these awful looking scars and stuff. And, being in the teacher now going into daycare, I'm real self-conscious of that. I get it on my scalp first, and then it goes to my face, and now it's really gone to my legs. So I'm excited that I got this posting about this group. I'm on a sarcoidosis face group, support group, and just a second. And so, oh, come on. There we go. So anyway, this is how I found out. So I'm just gonna kind of sit back and listen and hopefully learn a lot.
Oh, welcome aboard. Thank you for coming.
Is your name
Um,
Jackie or Jackie?
No, it is
Jackie.
Jackie. I missed the A and then I tried to go back to get the A in and it didn't.
Okay, so yeah, welcome aboard. Thanks for coming. We'll talk about the skin. We'll get some people to talk about it in a couple of minutes. I just want to get through everybody so to introduce themselves. Deb, can you introduce yourself?
Yeah, my name is Deb, and I'm from Cape Cod, Massachusetts. Here's the voice. It's coming and going. It's interesting listening to everybody's story. It's kind of like deja vu. I was misdiagnosed, I would say 25 years ago, with having allergies and asthma. And then 10 years ago, I had a gastric bleed, and they discovered what they said was a tumor in my intestine. They took out about a foot of my small intestine and resectioned it. But going into that, they said my lungs were a mess. And I had coughed for decades, thinking that it was asthma, allergies, and just God knows what. And then it continued. It got worse. I have Barrett's esophagus. I have interstitial cystitis. I have the lesions on my skin. And I finally kept going back and forth with the pulmonologist and the surgeon. The surgeon kept saying, we want the lymph nodes to be bigger, as they climbed on my lungs to 4 millimeters or whatever. They wanted them to get to 6. The pulmonologist finally said, you're going to Boston. You're going to Brigham and Women's, and we're going to find out what's going on. Well, surgeon took me right away. They did all the tests, the biopsies, and confirmed that it was sarcoid, and started me on a regimen of prednisone and antibiotics at the same time, which was the first time I had been clear and able to breathe, which lasted until they started me in October. It lasted till about February, and I got a cold, and everything kind of came back and it started all over again. So now I've been bumped up to 40 milligrams of prednisone. I'm on Advair. I have a rescue inhaler. I'm on, I don't know, a bunch of other things. And if things don't settle down by the end of the week, they want me to go back up, because they're also saying that there's some airway disease on top of it, like asthma or COPD. I also, of course, very embarrassing to say all this, but when I have a coughing attack, it's horrific. My whole body is like racked. And of course, being a woman, your bladder tends to leak and leak and leak. And you're like, okay, like one isn't bad enough. So that's kind of where I am. And I joined the sarcoidosis support group after I was diagnosed in October. And I was so happy to find people that have been through similar things, some much worse. I did have my eyes checked. They're watching that. I've had the heart checked. But in retrospect, I think what was going on with my intestines was also sarcoid, because when I went on the regimen of prednisone, a lot of my issues in that department have settled down. So thank you for being here. And it's nice to know that it's not all in my head.
Well, thank you for coming. And I'm going to go with Katrina. Katrina is also one of our moderators. So I'd like her to, just, tell us who she is. Yeah,
Hello, everyone. Hey, Frank, thank you. Good evening. My name is Trina Massey Davis. I'm here in Decatur, Georgia. I've been misdiagnosed for over 20 plus years. I have developed sarcoidosis in the right upper lobe of my lung. I had cardiac episode. Oh, I'm sorry. Trying to get together. Sorry. I had a cardiac episode. And right now it's still unconclusive. I hate that word, but that's where we at. So I seen my cardiologist last week, and we had a full discussion in regards to what to do next. So at this present moment, we had a standstill once again. There will be no further diagnostic work other than lab coming up in 3 months. What else can I say? I think that's it in a nutshell.
Okay. And like I said, she's also one of our moderators. So if you ever need to talk, she's always available also. I am going to go to Deanna. You just tell us a little bit about yourself, where you're from, when you got diagnosed, and where you have sarcoidosis. Deanna? Can't hear you.
She's muted right now, Frank. She needs to unmute herself.
Are you muted, Deanna? On the bottom, it doesn't say she. There you go.
Now?
Yep.
Can you hear me now?
Yes, we can.
No.
Yeah, we can hear you.
Okay, am I good now? Can you hear me now? Okay. All right.
You're going in and out.
Okay.
Deanna.
Okay. So it's been about a year and a half. I had a herniated disc, and I went in with I went to a chiropractor for a month. I'm sorry. I'm not sure what to do. I went to a chiropractor, and after a month, he had me get an MRI. And can you hear me now? Nope.
Yes.
Yeah, go ahead.
Maybe you can't hear me.
Yeah, we can hear you.
You can. Okay. So
Yes, we can.
anyway, all right, thank you. So I went and got an MRI, and next thing I know, all these doctors are calling me, and they thought I had cancer throughout my body. And after a lot of tests, bone marrow tests, bone biopsy, they said I have granulomas in my spine. And I also have spots in my lungs and in my spleen. So in February of this year, they made an appointment for me at University of Penn, but I can't get in till September. And now that doctor is leaving, so they're going to be changing my appointment. That's where I am with that. I do not have any symptoms of sarcoidosis. I do a special food plan, which I've done for a while now. It's Forks Over Knives, and I do exercise every day. So I'm not sure if that is helping it, or I don't know. But I don't have any symptoms. And that's where I'm at.
Okay. Well, welcome aboard.
Forks Over Knives.
Okay.
Okay. Somebody just asked what Forks Over Knives is. So if you go onto Netflix or you go to YouTube, there's a documentary. It's called Forks Over Knives, and it's a special food plan. It's vegetarian, and there's no oil, white rice, or white flour. You can have wheat, but you cannot have white flour or white rice. I've done that for almost 2 years before I was diagnosed with sarcoidosis. I was having problems with my stomach when I started it, which went away. I do eat fish, But it is a very good documentary. I follow that, and then I do 4 miles a day of exercise. I follow, there's a documentary called Living Proof. It's Matthew Embry, who has MS. If you watch that, you'll see he's doing basically the same thing, and he's never had to take medication for MS in 25 years. I also take CoQ10 and my vitamin. So I don't know if that is helping with sarcoidosis or if I have it. I have no idea. But I do not have any symptoms of sarcoidosis, but I'm told I have spots, all through me. So that's basically where I'm at.
Well, welcome aboard. And thank you for coming.
Thank you.
Is Petra, are you able to speak?
Yes.
Okay, I wasn't sure if you were on or not.
No, I'm on my phone. I was trying on the computer, but Norton and GoToMeeting do not like each other. So.
Okay. Well,
so,
tell us a little bit about yourself.
Okay. I just got diagnosed about a month ago with lung sarcoidosis. It was, I was not aware of being sick. I had a deep vein thrombosis, and they did a lung scan, a CT scan with contrast to make sure the blood clot didn't break off. And surprise, surprise, my lung looked horrible. And ever after, since then, I can't breathe. My memory is like going down the drain. I feel like such an idiot half of the time I'm awake. Yeah, I talked to Regina. She's really awesome. And I'm still so, I still can't believe that I have that. I don't know. I've been put on 40 milligrams. I cannot even remember the stupid name. That's
Prednisone?
Yeah, Prednisone. And I'm on that now for 10 days. I have no side effects of it, but I also, I don't know, I don't think it helps the way it's supposed to be helping. Maybe I expect too much. I do not eat red meat or barely ever. I mainly live off veggies and chicken, but I ate like that my whole life. I'm originally from Germany. And yeah, I don't know. I really don't know. I'm so confused right now still. And
well, you came to the right place.
Say that again, please.
I said you came to the right place. There's plenty of people that can help you.
Thank you. It's just too much, coronavirus.
Petra,
everything. Yes.
Just remember, you can call me anytime.
I know. I had so much going on here the last 2 days. My youngest going off to college, coronavirus. It's me going back to work. I'm working as a paraprofessional at the high school. Just thinking about that, do I really want to be exposed to all those crazy teenagers? I mean, I do, but I also don't,
I have a crazy teenager at home, so I'm worried.
Yeah, I'm working in special ed, and I'm the hugger there. Everybody comes to me. They get their daily hugs if they're down, and I don't know how I feel about that. So it's rough.
It's gonna be. I know with COVID, it really put extra pressure on a lot of people, and that's one of the reasons why we made 3 days a month. We were 2 days a month, but we moved it to 3 days a month. So just to help everybody out. And I did want to introduce you all to Rick. Rick is he's in charge of ANCAN, which is the organization that started these groups. And he reached out to to me, or I reach out to him, one of the two, I forget. And we made this sarcoidosis group. He has a bunch of other groups going, and he's growing and growing and growing. But he's the one who set this whole thing up for us. So I just wanted to introduce Rick, and Rick, say hi to everybody.
Hello, yeah, I'm listening to all of you, and it's a miserable disease that you guys live with. But I think that with this peer support, especially from some of your moderators and Frank and Kathleen, it makes life so much easier. I mean, one of the things that we have, all our groups are peer led, and there is nothing like peer support. It is the best. It is more knowledgeable and more effective than anything else you're going to find. It's especially true for these rare diseases, because these guys know all the ins and outs, and you are in a great place. Frank, I'm moderating a meeting at the top of the hour, but I would love to hear a little more about this new entity of yours and Kathleen's. I want to hear about this.
Oh yeah, we're starting to promote, like I said, it's Stronger Than Sarcoidosis. So we're really starting to get a little bit more and more. We've sent in the 501c3 to the IRS and just waiting for them to send it back to us.
Mm-hmm.
But they fast tracked us, which was great. So it'll only take 2 to 4 weeks instead of months and months and months.
I'm very happy for you, and I hope it's very, very successful. I really do. And anything we can do to support stronger for sarcoidosis. What is it?
Stronger Than Sarcoidosis.
Stronger Than anything we can do to support Stronger Than Sarcoidosis. We're there. Just ask.
Thank you very much, and we do appreciate your help. You know, this is a great medium for everybody to talk on. So we do, do appreciate that that you helped us to get this thing going, and it's like you said, it's moving now. So Kevin, are you there? Uh-oh.
Yeah, I'm here, Frank.
Hey, all right. Why don't you just tell everybody a little bit about yourself? And then I'll go to Wendy.
So my name is Kevin. I've had sarcoidosis, that first diagnosed 10 years ago, in the lungs and lymph nodes, and I guess interstitial tissue, because I found it in my ring finger with a lump there. Looking back, I probably had it for 20 years before that. I had, misdiagnosed with asthma and allergies, and all the way back into childhood. So might have gotten some early exposure camping or in the house. We moved into a new house just as I was being born. So all those could have been the root source. Most recently in 2020, which, by the way, you can have the entire year back. I'm looking for the undo button if anyone finds one. I was in a motor vehicle accident in January, and it kicked me off into the most severe, crazy flare-up that I've ever had with this disease. It started with atrial fibrillation shortly after the car accident. Was feeling fatigued and tired and banged up, of course. I had a car accident, and went to the hospital and was diagnosed with AFib, and it was 3 months of every cardiac procedure you can imagine. They finally did a PET scan and had cardiac sarcoidosis, 3 or 4 major arrhythmias. We decided in late February to try to get in before the pandemic peak and implant an ICD. So I had a pacemaker and defibrillator installed, and I've been on 40 milligrams of prednisone ever since. They put me on methotrexate about a month ago, and after 2 weeks, my liver panel blew up. So I'm off of that and waiting to see what's next. Today's a really bad day. We had a major hurricane come through Philadelphia, and had just finished, was working on finishing the basement in January when I had the accident. Finished it up, and the water decided to come through a window. It was pouring, so I went and got blood work for my liver panel this morning and came back and had water rushing into the basement. And so I've really been struggling with chronic fatigue, and it really, with motivation and effort, can get to 1.5 miles to 2 miles a day walking, which is about 5% of my capacity before. And today, having to tear up the carpet and vacuum and just a lot of activity all day. I am just completely wiped out right now. And I'm curious and fearful what this is going to feel like in a day or two, because I have a feeling this is going to kick my butt. But it is what it is. This is a crazy disease, and gotta thank God for all the blessings, and show gratitude where you can. So I'm grateful. I think I'm gonna be able to save the carpet. I'm grateful I'm still alive, and hopeful the other side of this is manageable and has a reasonable quality of life.
Hey, Kevin, this is James. I have a question for you.
Yeah.
What was your dosage of methotrexate?
Like 10 milligrams.
Oh, wow. And when you said it blew up your liver, how did that manifest? What were the symptoms?
My APT or ALT, I could look it up. I have it in a chart that I keep all my medical data in. It went from like 5 to 292.
Isn't that PCT, Kevin?
No.
No? It's not the A1C.
No, it was, there's 3 liver enzymes that come out in the basic metabolism, the BMP.
Okay.
It's ALT, APT, and AST or something like that. I don't know, one of them just, my doctor called me back the next day, like, stop. I'm like, dude, I took it yesterday, so I was due for 6 more days, but okay. So they're looking at a bunch of other steroid-sparing drugs that might be useful.
Might be going to Remicade next.
Yeah, there's some mention of hydroxychloroquine. There's some mention of cyclo something. I really want to change the conversation with my doctors to like figure out what's going on, instead of just dealing with the fact that granulomas are at the like end stage of this process. So like why is it the reaction so different this time? I've had this for 40 years, let's say. I've been in motor vehicle accidents, I've had concussions, I've had, other physical traumas. For me, historically, the emotional stress side has been the trigger. Yeah. So, as well as pathogen based. So I believe in 2010 or in 2000, when I had a flare up, I couldn't breathe camping. I think that was a pathogen by something I was inhaling that was setting me off. But then in 2016, I had a partial bowel obstruction, which I believe was sarcoidosis in my, either in or on or around my GI tract, causing the obstruction. But, the doc in a box was like, no, you're good. I'm like, no, I'd rather know the root cause, but nobody really engaged in the conversation. So I never got any satisfaction out of that.
Kevin?
But, yeah.
Question: how are they going to treat your elevated liver enzymes? I mean, what is the next step? Because I hear pushing medication, but how are they going to get them liver enzymes down?
So what they did is they stopped the medication. They stopped the methotrexate.
And then it immediately goes back to normal, or it's a process?
I'll know tomorrow because I had my blood drawn today.
Okay. I'm just
So,
concerned about, I mean, I'm
thanks to
concerned
the
about you, period,
pandemic,
but just, yeah.
you know, it's
Yeah.
like 3 weeks now to get blood drawn.
Mm.
So everything's
Thank
slowed
you.
down. It's I
Okay.
feel your frustration when it's like, you know, oh, you want a doctor appointment? Yeah, well, we can see you in October. I'm like, how about next week? You know, I've had a concussion, probably traumatic brain injury, coupled with possibility of neurosarcoidosis. I don't know, but the brain fog and the confusion and getting lost in the middle of tasks and like no memory function anymore. I've been trying to see a neuropsychologist at Jefferson, where all my sarcoidosis stuff is now, for 3 months. And I finally am going to see one on Friday, only because I called every week for a month. Said, hey, it's
Wow.
me again. Anything open up on your list? No, not this week. Call back next week and call back next week. I'm like, hey, we got one. So, you know, it's been 3 months of dealing with, you know, am I losing my mind? Is it recoverable? Do we lose the window? I know with like a stroke, and you got to get on it in 48 hours or you lose or potentially lose that function. It's
Right.
been 4 months. Oh, wait, January, it's August. So it's been 7 months. I'm sorry. See, memory.
Yeah.
So I'm completely
Sorry,
wiped out.
sorry. But you can always talk with us. You know, you have a lot of people here who understand, and you know, you can always talk with us. And I'm glad you're here.
I'm glad this is here for me, and I get a lot out of this, and hope I can contribute more in the future. I have a quick question. Has anyone actually had success in dealing with the antigen that was causing their sarcoidosis? So whether it was a P. acnes infection or a herpes human virus 8 or what is it, mycobacteria? There's like 5 or 6 suspected
Yeah, they don't
pathogens.
know exactly yet. They're going to. Some people are going pathogen way. Some people are going DNA way. Some people are going just environmental.
RNA.
Yeah,
Right, but there's 5 pathogens.
yeah.
Is there tests for them? Like P.
Most
acnes.
of our, you know, it's funny. Most of our testing and all the education we get is mainly in Europe.
Yeah,
They're doing most of their testing first, and they actually have gotten a lot done, but it's still so far behind. I mean, you know, we all, well, if you know anything about this disease, this disease has been around since the 1700s.
Yep.
How can we not know anything about this disease? It's just beyond me. So,
Finding out the cause, would that change the treatment?
yes,
Absolutely.
the cause. Every doctor that I speak to that is a sarcoidosis specialist says as soon as the cause is found, it'll be like dominoes. Everything else will fall into place. It's
Well,
just a matter of finding the cause.
I've already read reports. This guy in Australia, he's like, he did his own case study. So he got really engaged, worked with his doctor. They discovered that he had a systemic P. acnes infection from a surgery, right? And they developed they were using 2 antibiotics, and it was like a 2-year treatment, and he went into remission. And I had surgery back in 2018, and I'm wondering, and it's showing on the PET scan that there's inflammation and activity, which means it's probably infected. And I'm wondering, like, is that the infection that was present when the accident happened, and that caused it to spread in a way it's never been in my body? I don't know. I'm just really frustrated with the medical profession. It's just like, well, we're going to treat the granulomas in your heart. I'm like, that's so ass backwards. You know, I ran businesses.
To be honest with you all, I wouldn't be surprised if it came from a vaccination. I mean, that's just how I feel.
I had in 2000, no, 91, and in 97, I had probably 17 vaccinations going overseas.
Woo!
and it could have been from one of them as well.
It's just speculation, but I mean,
Yeah,
we
they
just
put
trying
stuff
to
in there.
figure out, yeah, just basically trying to figure out, bridge that gap, what we all have in common, what, you know, what have we been exposed to, things of that nature, and
Yeah.
taking a different approach, because at the end of the day, like Frank was saying, these physicians, they don't know. It's a guessing game, and I think we all are frustrated at some point, but we can't give up, you know? And having roundtable discussions like this is very helpful, give you some insight, provoke thoughts, positive thoughts. And it's just welcoming to know that, you know, we all are on the same accord, and we have some things that we want to get out on the table. And it's very helpful to have this platform to do that.
And Kevin, the one thing I could always tell you is pretty much all of us are frustrated.
I know I'm frustrated because
we feel we feel your frustration.
I have to. Can I just make a comment?
Sure.
Because when they found my sarcoid, it's crazy because it's the second time in my life I've had pneumonia, and I was born with pneumonia. And then when they found my sarcoid, I had pneumonia again. It's like, you know, so it makes me wonder, you know, if I was just born with the sarcoid or what, you know what I mean? If it was a genetic component for me. So it just makes you wonder. So maybe there are a whole lot of different aspects to it and they just can't pinpoint it. So I was born with pneumonia, and then when they discovered it, I had pneumonia. So I'm wondering if I had it when I was a baby. So,
Did you experience any flare-ups while you were growing up?
I have been sick all my life. I was the only sick child all my life growing up, literally. My mom said I was the sickliest child she has ever seen. So I'm beginning to wonder if I've had it all my life, and then it just manifested itself when I was 34 years old.
Wow.
This is when I had pneumonia again, and it finally manifested itself.
I just want to get to Wendy and James before we keep on with the conversation, because they didn't get to talk yet. So Wendy, you can you speak?
Yes, I can. Thank you, Frank.
Okay.
Hi.
Sorry about that.
Oh, no problem. I'm glad you're feeling better, Frank, and I'm hoping Trina feels better. I had a meeting today with my new doctor that I finally found, Dr. Mazawi, and she's wonderful, and she's supporting me and trying to maneuver me through all my doctors that I have, all my new doctors. And just the fact that she acknowledges that I have this disease, now all the other doctors are acknowledging and being very polite to me, because it was very hard to maneuver through this. But I would like to tell you that this platform has been the most helpful for me to find out about this disease, and I don't know why God put this to all of us, but I think it's very helpful, and I think it's going to move us in a better direction by having this group. I think this is going to be 90% of us getting forward is with groups like this. Thank you.
Thank you, Wendy. Just so you know, Wendy's from Rochester, New York. So I don't think she was able to say that. But the reason I left James for last is there is a reason. I wanted James has some things that he would like to say to us. Go ahead, James.
Well, I'm going to turn on my camera. I'm a little camera shy, but I'm going to show you who I am. Hang on. One more time. Doesn't seem to want to go on. Well, okay. Never mind the camera. So I have, first of all, Frank said there's some new people here, and I got to tell you, Frank has a book on Amazon you should get. It's really a good read. So I'm not plugging for him. I'm just telling you that I really appreciated the time he put into putting a book together. And I want to embellish what Wendy said about this group. I've been on this group. Actually, I didn't realize you started in December because that's about when I got on the group. And it has been a tremendous resource for me. And the other gratitude I want to give is my doctors. I'm in San Francisco, and we have a big HMO out here called Kaiser. And it was actually created for the shipbuilders in World War II that couldn't afford health care. Doesn't that sound familiar? Anyway, they are quite a huge organization in the Bay Area. And I don't know how I got so lucky, but I got 3 doctors, a cardiologist, a rheumatologist, and a pulmonologist who all really worked together to figure out what was wrong with me. I've been an athlete for 50 years, and all of a sudden things just went haywire on me. And I got really, really sick in 2018 at Christmas, the whole month of December. And my doctor, regular doctor, took a x-ray and found a nodule in my lung. Well, I had a bronchoscopy on that, and it turned out negative for sarcoidosis, which I was like, yahoo! But my cardiologist, then they found out I had atrial fibrillation, which is called AFib, which means an irregular heartbeat. And my problem was not too fast a heartbeat, it was too slow. My resting heart rate was 37 beats per minute, which, you know, in some is dead. Anyway, my cardiologist would not quit until she figured out what was going on with my heart tissue. So I had a PET scan, and they figured out it was sarcoidosis. So it was in my heart, it was in my spleen, and it was in a couple of my ribs. So I started in, let's see, that was November of 2019 at 60 milligrams of prednisone. And I'll tell you, I had days that I would describe to people as I'd wake up at 3 o'clock in the morning and I wanted to go clean the kitchen. Yeah. It was just unbelievable. I had another personality. And eventually I'm down to now 17.5 milligrams, and I'm much more human, and that's my taper. But last month, my doctors wanted to put me on methotrexate, which I've asked a lot of questions on this forum and got a lot of really good feedback. But I said, well, let's do a PET scan first and see where I am with my inflammation. And I went to Kaiser in San Francisco, which is a huge hospital, pain in the ass to park, et cetera, et cetera. But I had my PET scan, and it turned up with no more sarcoidosis in my body. It was gone in terms of, you know, how it lights up under a radioactive scan. And it's funny because I had the scan, I was driving home, and the doctor called me on my cell phone while I was driving home. He said, "You're not going to believe this, but it's gone." And I went, I was incredulous because I have listened to all of you and noticed that this thing doesn't go away on its own. You know, it's its own disease and everything. So I had a little bit of a problem at the last meeting because I knew about this, but I didn't know how to tell this group. And so I consulted with Kathleen, and she consulted with Frank, and she said, you know, tell your story. There is a light sometimes at the end of the tunnel. And I'm not high-fiving as much as I am saying that I just thought I was incredibly lucky to A, discover this group, B, have the great doctors that I did, and C, you know, that I actually recovered from this. But the part B of this story I'll get into in a second, but I also want to say that I learned something really valuable from Kathleen, that you never really get away from sarcoidosis. You know, it's not, okay, I'm done. You know, I can move on, I have a different life. And so that's when I'm looking at the methotrexate to try to keep it from coming back, and in a low dosage. So I'm working with my rheumatologist on that.
Sorry, but this is great news. I'm so happy for you. I
Well,
can't,
thank you.
I am so happy for you. I had to interrupt you. It's just wonderful.
Well, now I got to tell you part B, because I went in for I have an ICD that was part of, and that's called, it's called an implantable cardioverter defibrillator. And it's this little thing that's above your heart that they implant in your chest, and it keeps my heart at a constant rate. It's not a, what's that thing called? There's another thing that actually controls your heart all the time. This is actually a defibrillator.
A shock
And
of,
yeah, and if I ever get up to like 190 or beats per minute, it kicks in and it gives me a shock. Well, this thing has been regulating my low heart rate for a while, and I've had constant afibrillation ever since. So I went to the cardiologist to have it adjusted, and she said, "Do you know that you haven't had any afibrillation for a month now?" And I had it constantly for the last 9 months. And this is about the same time that the sarcoid disappeared. And the theory was that sarcoid was interrupting the signals from the top of my heart to the bottom of my heart. And if that inflammation went away, that it might return to normal, and I'd use my sinus rhythms instead of the device. And that has actually happened. And it's, I think it's two miracles at once, to be honest with you. I just
That's
can't,
so awesome.
I can't be thankful enough. Sorry to go on, but I wanted to tell the whole story.
That's why I
And
saved you for last.
well, one last thing. You know, I don't plan on exiting stage left here. I'd like to stay with this group. I think I've been so encouraged by you. I think Frank and Kathleen and all of the other moderators just do an incredible service to you guys. And I'm so glad I discovered this. It's been a real inspiration for me, and I hope I am for you as well. Thank you, Frank.
James, that was amazing. Thank you so much.
James, what is your
Katrina.
blood type? I'm just curious. What is your blood type?
I'm sorry?
What is your blood type, James?
What's my website?
No, blood type.
Blood type.
Oh, blood type. I'm a O positive. O positive.
We're gonna have to do. Oh yeah, we need you old people. We need you old people. I think you have the cure. I think y'all have the cure.
I'm an O positive myself.
Me
Oh,
too.
my.
James, James, I have a question. How long was it before they started you on prednisone and your PET scan was clear?
I had the same question. Thank you.
So it's funny. I started my 60 milligrams of prednisone the day I had my implant, which was November 18th, 2019. And I had my scan on July 20th of the following year, and that's when I was all clear. So that's what, 9 months?
Okay. And you've been tapering your prednisone?
Yeah, yes, I started at 60 and it went down 5, and now it's going down 2.5, and I have to stay on it for 10 more months, according to the paper.
Yeah.
So you could have had the acute version of sarcoidosis, which is 80% of the cases that they see.
Oh, is that right?
So 80% of the cases resolve themselves within 2 years.
So what does acute mean?
They go into remission, actually. They don't.
Acute means it comes on hard and fast,
Yeah.
and it goes away hard and fast. It's actually the type you want, because what everyone else has got, they call chronic, smoldering, refractory, and what that is it just keeps coming, and it sits there in the background, and then any stressor or any other thing that causes your immune system to have to respond, it's already compromised because it's fighting all the time and it's tired, then anything can set you off into some crazy land, which is what I think happened with me.
Yeah, James. Okay, Kevin.
All right.
So what we were telling Kathleen and I were telling you is that, and I'll tell this to everyone, is that you could, once you have sarcoidosis, you could go. It's like having cancer. You go in remission. You don't. lose it. And that's why they put you on the methotrexate, is to make sure that you don't have another flare up, is the best way to describe it. I have a brother-in-law that got sarcoidosis in 1997, and then just last year he had a major flare-up out of nowhere. So that's why I'm not trying to put you down, James, at all. I just want you to be careful. And if you see any symptoms, make sure you get it checked out, because that's one thing with my brother-in-law. He was like, no, it can't be the sarcoidosis, and he ended up getting pneumonia because of it.
Wow.
So just be careful. If you start feeling any kind of symptom, let your doctors know, because I'm not saying it will come back, but I just want to make sure. I want to keep you sarcoidosis free as long as possible.
Frank, you said, what about the pneumonia? I couldn't hear you. Something.
I was saying that in 1997, my brother-in-law had sarcoidosis, and it went away within months. A high dose of prednisone, and he was fine. Then last year, he started to have trouble breathing and stuff like that, and he wouldn't go to the doctor. He's like, it can't be my sarcoidosis. I haven't had it in 20 some odd years. Well, he waited and waited, and he ended up with pneumonia, and due to the sarcoidosis. So but the good thing is with that is that they gave him the high dosage of prednisone again, and he's free again. He's not, it's just, it's one of those that it's an acute case, but unfortunately it can come back and back and back if you get the right stressors, or if you get unfortunately, that these granulomas, like when you get a PET scan and they say you're free, it means that it's not active. That's the best way to describe it. It doesn't mean that it's gone. It just means that's the best thing we could all hope for, is that it's not active, because you can do so much more when it's not active.
So Frank, when I went to my immunologist, he was talking about that, and he said another thing that I have to do is get my anxiety down, because that can make my flares come about.
Stress is one of the number one problems for sarcoidosis that we have, because stress activates your body, and then all these blood cells and all these granulomas start acting. You're putting your blood you're making your blood go faster. You're making everything go more. Your heart goes faster. Your brain, everything. So you're leaving yourself so open when you are either have anxiety, depression, stress. Any of those three I always say, it could be I consider almost a killer.
True.
I know it's so hard to stay away from it, but that's why when everybody sees me, I'm always smiling. That's one of the reasons why I'm always smiling, because I refuse. Like I wrote down about my book. I have sarcoidosis, but it doesn't have me. And I live by that. I don't want it to run my life. Yeah, it has changed my life, but I know what the new me is, and I can accept the new me. And even if it does change, like I know sarcoidosis is going to change my life each and every time. It's just that it's just the nature of this beast. But I'm not going to let it. When I say I don't have sarcoidosis, my brain, even though I'm neurosarcoidosis, my brain, when I think about it, I don't think about sarcoidosis running my life. And that's the best way I could describe it. Go ahead, Trina.
I'm sorry. I just have a question for anybody who can answer this. I just came off of prednisone. Now I would like to know, are you having the same cravings I'm having? I've been craving sugar.
Mm-hmm.
Yeah.
I would eat
I
24
had
hours a day.
the coffee cake, the Hostess coffee cake. I go through the box in 2 days. It's 8 little miniature things, Today I found myself eating M&Ms. It's just the sugar, like I'm on a sugar high now.
Well,
Mine
because
is potato chips and carbs.
well,
Can
the
I
thing
say
is that,
something about the sugar?
yeah, go ahead, Regina.
Be careful with that sugar, because I believe that's what sent me straight to the hospital and in the hospital for 2 weeks.
Well,
Prednisone will do that to you because your body is craving all that sugar because your body can't process it anymore. So it's like your body is missing that. So that's why I spent the 2 weeks, and I did not know that until I wind up in the hospital and they started explaining that to me. So it can send you into a diabetic coma. So you better be watching that, and your sugars will go up really, 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 really high, like mine did. That's what I was saying earlier. It sent my sugar levels to 511, which gave my A1C a 12.8. Pay attention to your sugars. Everything has sugar in it, so you're gonna want to pay attention, and including your starchy foods. Deb, pay attention to your starchy foods. I have learned a lesson. I'm telling you what, I've stayed away. My A1C, like I said here recently, I took it last week, 5.5. You want to stay up under a 5.7. Always stay up under that 5.7, and your blood sugars will be normal.
Okay, so since you've been through this, what did you do to kind of curb from, because it's not something that I typically would do. I'm not
Exactly.
I'm more like a salt person.
Stay away from that too. You got
come to like my kettle chips or something like that.
You got
But how do you curb coming out of it? How do you curb it? It's not like it's something intentionally you doing to yourself. It's just something that you got that wave.
It's a mental thing. I'm telling you. I found out it is a mental thing. I actually had to go to a diabetic class. It's what I did. After all that stuff happened to me, I went to a diabetic class, wind up learning how to measure my food, how to do this, how to do that. So you got to mentally think about what it is that you're doing, and you got to just mentally say, oh, I cannot eat this. It's starchy, it's salty. I cannot eat this. It's got salt. So you want to eat a lot of like fresh vegetables, like a cucumber, like zucchini, some broccoli, some cauliflower, some lettuce.
I can only eat asparagus for so long, okay? Seriously, I mean, I really did. This last week, it's really been bad. And it's like, oh my God. In the middle of the night, I roll over and my hand is in the box before you know it. TV is on and I'm eating snacks.
I'm going to give you my phone number so we can talk.
Okay.
Look, write it down.
Also, one of the things that you should look online, go look for the fruits that have good sugars. There are some fruits that have good sugar, and that'll help your cravings, because there is good and bad sugars.
Well, I have been eating. I bought, like, my mom, she gave me like 6 bags of cherries, and that helps with inflammation, in case y'all need to know.
Yeah.
And I eat in the morning. I'll eat, and then at night, like sometimes I don't even deal with the snacks. I'll go right to the kitchen and I'll eat them cherries. But it's been rough. When I tell you it's been rough, it's been rough.
That's because your
and I have never.
Prednisone asks for your sugar. Prednisone rises your sugar and wants more sugar. So when you get off of prednisone, it's like it's like a drug. You want more. That's what if you when you're on high doses of prednisone, the first thing sarcoidosis doctor is going to look at is your sugar levels. Like mine are high right now because I just went off a high case. But that's one of the things that they look, because, like Regina said, you can get diabetes from prednisone.
Oh yeah.
Okay, so it was telling your body you wanted sugar, and then it stopped. So you're in that stage right now. Is like when you, somebody's on drugs where they need it right now, you need that sugar. And that's what your body thinks it needs. So you, like I said, try to look online for the good sugars. Kathleen, I know you wanted to say something quick too, didn't you?
Trina, don't buy it.
Yes.
If you don't buy it, you don't have it, you can't eat it. I'm on 14 days of prednisone. I didn't buy anything.
Yeah, but
I
then you have
tell you,
husband,
Catherine, it's
husband
said
looking
than
for
done.
food.
I went through a whole bag of roasted peanuts. I done went through a whole bag. This was between yesterday and today, including cherries. I'm like outdoing myself over here. It's like, ooh, you know.
Yeah, unfortunately, that's prednisone for you. Right, Regina? Where's it? We know exactly what you're talking about. Yeah, it's funny because like just this, the last bout with prednisone, I gained like 20 pounds. I'm like, what? I was only on it for a month. Are you kidding me?
And the funny thing about that, well, it's not funny. In the beginning, years ago, I used to gain the weight. Here, within the last 3 times that I have been on prednisone within the last 3 years, I'm not gaining the weight. I'm getting like fluid retention around the ankles, of course, around the face, the swelling, and then it subsides. But I have not, if anything, I lost weight, to be honest with you. And I can't afford to lose any weight. But I don't know what's going on with that. Maybe my body just is so accustomed to having that drug that it's just reversing. I don't know.
Yeah, so
I
totally
just
understand.
I just have a quick question about the skin sarcoidosis. What has anybody been treating it with? You know, I've just been the pulmonologist that is handling my care right now. He just gave me hydrocortisone 2.5, which is prescription. It's doing nothing.
Nope.
I tried it. It doesn't work.
Hydroxychloroquine or Plaquenil is probably about the best stuff that's out there because it's internal.
Okay, what is it? What is it, Regina?
Plaquenil.
Hydroxychloroquine, the drug that's already out there that been taught it for other stuff.
And I use a cream, and it's a prescription. It's called Topicort. It's Dexa something or other, but it's called, the brand name is Topicort. And I put that on topically, and it does bring it down.
Okay, could you spell that for me?
Sure. Topicort.
I think I've used that before.
Yeah, it's been a saver for me because the Plaquenil raised my liver enzymes.
Yeah, in fact, speaking of methotrexate, I know somebody was talking about methotrexate. My doctor is weaning me off of it because remember we were talking not too long ago how my red blood cells and white blood cells were below normal. They are weaning me off because I was concerned about that. So I'm down to 4 pills a week for the next 3 months. Then they're going to take me down to 2, and then they're going to take me completely off of it because they're messing with my kidney functions right now. So
the one thing I could say to everybody is that every one of the drugs that we use have multiple side effects.
Yeah.
And the reason they call us snowflakes is each one of us, like somebody works great with methotrexate, another person works great with Remicade, another person works great with prednisone, and there's people like me who don't work good on any of them.
Well, I'm starting to be like you, Frank. I can't use prednisone anymore, and now the methotrexate is messing with my kidney, so I'm getting ready to be off of that. Right now, Remicade is doing fine for me, and my primary care, she's already scared that my body is starting to get to the point where it's not accepting a lot of medicine. So
one thing I would tell you all is when they tell you about a medicine, look it up or ask one of us. I pretty much could recite almost every drug what their side effects are at this point now. That's how bad it is. But yeah, if I
Frank,
can't,
what does someone like Regina do though? What does she do if she's saying that all these
well, she'll
drugs?
stay on the Remicade. She'll
Yeah,
stay on the Remicade because the Remicade's working.
Yep.
But I mean, it's actually better if she gets off of the methotrexate and just stays on the Remicade. The more drugs you take, the more harm you're doing to your body on the side effects. So it's actually a better thing if she just has to take the Remicade.
so why did they introduce her to the methotrexate? Why did she have to?
I've been on the methotrexate for years, so they're weaning me off of it now.
Yeah, and like every other drug, you have to remember that your drugs, with drugs, you don't, you're not supposed to stay on them for extended periods of time. But I guess that's Trina. But your body doesn't do well with drugs over extended periods of time. Just to let you know, whether it doesn't matter if it's prednisone, methotrexate, the Remicades and the I seem like the Remicades and the IVIG infusions are the ones that have been lasting the longest for people that they can stay on the longest because you don't like Regina. What are you on? One every what? 3 months or 6 months?
Right now it's every 4 weeks.
Oh, 4 weeks. Okay. Yeah. So yeah, you don't go. It's not like a drug that you take every day. There's a lot of drugs, that, so that's why a lot of people can stay on them for longer. And then
What was the name of the infusion, Frank? I'm sorry.
there's Remicade,
Yep.
and then there's IVIG, and there's another one called Rituxan.
I have to tell you though, if you're still working and you have insurance, I'll tell you right now, your insurance will not let you get Remicade unless you've maxed out on all your other different types of therapies. So you have to try all your other therapies before your doctor even recommends Remicade.
Yeah, there's a ladder you have to go up before you get these things, unfortunately.
Yep.
And the insurance, which it doesn't make sense to me, the insurance will pay extra money for you to take another drug, just that even though you know it's not going to work, just to get to the next level. It's ridiculous.
Exactly.
Well, it's going to be interesting come October when it's open enrollment for all of us.
No,
yeah.
Well, he's
trying to screw up now.
If we have any insurance, we might be going down there to the Board of Health.
Yeah, so I know we went a little over today, but I think it definitely was worth it. People, especially when we get a lot of new people, I really like to make sure they feel comfortable. And if there's any other questions, like I saw Debbie, you're talking about the gaining of weight. Yeah, that happens unfortunately a lot with the prednisone. It's either one or the other. I know a lot of people who gain weight, and I know a lot of people who lose weight. And I'm like, I wish I was on that. But yeah. But so.
Hey Frank, I just wanted to let you know something. Frank.
Yeah, guys.
I just wanted to let you know that here pretty soon I'm going to start an online on Saturday, probably just once a month for my Indiana group here soon.
Awesome.
And it's just going to be probably about a 30-minute online session for support. It's not going to be real long because I notice a lot of the people from Indiana can't meet through the week because they work. So I was lucky to see Petra pop up today. So I'm going to start something probably on my own on Saturdays. So I'm going to.
When you start.
Okay, I will.
When is the next meeting for this?
I was just about to say that. 13th, August 13th.
13th. 13th? Okay.
13th.
Tuesday, 13th?
No, Thursday the 13th. Thursday.
Thursday the 13th.
Yeah.
Right. And then the next
when is the one after that?
Yep.
You know when the one is after that?
August 25th, Frank?
Yep.
So it's usually the first and the last Tuesday of the month, and the third Thursday.
Okay.
First
Thursday,
and
second
last.
Thursday?
If you're still
No,
online, I
second
want to
Thursday.
show you what I
I want that.
They
Sorry,
have them
that
at
was
Costco,
loud.
right? You said?
Sorry.
got. Costco's. If you got a membership at Costco's.
Regina, I'm sending you my
I
credit
need that. I need that fix. I need that fix.
card. Trina, me too.
I'll pay how much I owe you.
You're gonna be buying
what
like
kind
two
of
pieces. and
Regina,
sell them.
Regina, you're my pusher man.
Regina, we're gonna all give you our credit cards, and you need to mail them all to us.
Yeah. Do the meetings
Oh,
always
God.
start at 6?
6.
Yes.
Yeah, Central Time
7.
6. Yes.
Oh, I thought it was 7.
7 Eastern. It's 7 Eastern, 6
Okay.
Central.
Right.
He's on Central.
Yep, I'm on Central.
Just one last thing I wanted to say is that a week from today, we're having a Zoom meeting. It's for social justice, because it's been something that's been on my mind and a lot of other people's mind. Trina knows about this, and what we've been working on helping sarcoidosis patients who really were having trouble with all the racial injustice that was going on, and they couldn't. You can't protest because you can't go out when COVID's around. You can't do this, and you feel kind of that's part of the stress aspect that I wanted to go over and make sure. So we have doctors, we have mental health doctors also coming. We have government officials showing up on Tuesday. And we have 5 people from Bernie Mac organization coming, which is also another sarcoidosis Bernie Mac Foundation. 5 of their board members are coming to talk about sarcoidosis also. So the whole thing is going to be geared towards sarcoidosis and how to alleviate stress. There is parts about it, about social justice. I will put the register link on, actually I'll put it right here for the people who, you just register at this link here. Here it is, sarcforjustice.com. And you just sign up, and it'll give you the Zoom link that you would just click on Tuesday. That it starts at 7 o'clock Eastern, 6 o'clock Central, and it's at 8:30 also, ends at 8:30 Eastern, 7:30 Central. But I think it's really going to be worth it for a lot of people, not just for people who are looking at social injustice and stuff, because like I said, I mean, Bernie Mac went full force into this. They got 5 doctors that are coming from their board. So it's really good time to get to know them and get some answers. They will be answering questions on the registration form. It actually asks you if you want to ask any questions. So if you have any pre-questions, and ask them during the registration, because those are the ones that are going to be asked first. So and the other ones who ask at the time of, they may have to wait for answers until we're able to get it back. That's something that really could help the sarcoidosis community get together.
Okay, I didn't have a question to ask because all I did was hurried up and signed up because I wanted to make sure I had a spot.
All right, you want to email me? You can email me the question.
Okay.
Yeah, my email. Yeah, just email me the question because I'm setting up all the questions tomorrow, actually. But yeah, so it's just like I said, it's good for everybody for sarcoidosis patients. I don't know that answer actually, Wendy. Actually, I know James is the first one to actually tell us. I don't know, Kathleen, do you know of any?
Hold on Matt, I'll call you back. I'm so sorry. My son called me because he's out of power. I'm sorry. Could you repeat the question, please?
She said, how many people left this group because they went into remission? I said, James is the
None.
first one I know of.
Yeah,
He hasn't
other
left.
than and James is not going to leave us. He's going because you know what? He's also James, and I know you're on. So you're also another source. I mean, it's not just about myself, Regina, Trina, Deb, Frank. It's about a collective. That's what Trina, Regina, myself, and Frank wanted to start this for. It wasn't just for us to be supported from each other, but for all of us to support one another. And each person has a different story, and we want to hear them. And James, we don't want you to disappear. And you know what? I am so thrilled that you possibly are in a remission, and I pray every day that you will never get this beast back. And all of us are going to pray that, to be 100% honest with you. But
Well,
um,
thank
so
you, Kathleen. Thank you,
you're
Kathleen.
welcome. You're welcome,
I'm
James.
here. I'm all in. I'm here.
Good. Yay. See, that goes for you too, Jackie. All right. I don't want to see you disappearing on us.
Right.
All right.
I will not be able to make the next meeting because I am going camping. I tutored all summer.
Oh,
And
awesome.
I decided to stop the tutoring on Thursday. So I'm going camping the 13th through the 16th before I start my new job on the 17th.
Okay.
Great.
I'm glad to see a lot of new faces. It was really, really nice to have that today. It's, I mean, I love everybody, all the old faces, but we run out
Well,
of
I've
things
been
to
trying
talk
to
about.
promote in my Indiana group as much as I can. And
Yeah.
that's when I happened to catch her right at a good moment too. So I emailed her, I texted her today, said, "Come on in."
And then what the new organization, Stronger Than Sarcoidosis, we've been putting it out there too to join the group, and we like Deanna, that's what she came through from that. So yeah, we're going to be pushing it a lot and trying to get more. And if you're in groups, let them know that we're here, because we want them to come in. I would love to have 100 people in this room. It would be hard to moderate, but I'd still love it. And Trina, yeah, I could use you on that 811. Yeah, definitely. I'll email you. All right. So, all right. Well, I guess we really ran over our time today, huh? But it was worth it.
It's okay.
All right.
It was very good. Thank you.
Thank you.
Thank
And
you.
I will talk. All right. I'll talk
Thank
to you
you.
all. Well, either
Good
what
night.
is it? The 13th.
Good night.
All
Thank
right. See you
you.
guys later.
Bye. Thanks, everybody.
Bye.
Take care.
Bye.
Good night.